From News 8, this is Live Desk Conversations with digital anchor Luke Laster.
All right, ladies and gentlemen, thank you for joining us here from the Wood TV Live Desk. My name is Luke Laster, here for another Live Desk Conversation. This morning, Dr. Assaad, he is the Chief Medical Officer for North Ottawa Community Health System. Dr. Assaad, thank you for taking the time to join us. How are you today?
Good, how are you?
Doing well, doing well. So, topic of discussion today is largely surrounded by COVID-19, obviously, and a big point that we will hit on is vaccinations. We will get to that in a moment, but I do want to start off with a few lead-off questions there. How is North Ottawa Community Health System holding up right now? Are you seeing the influx that was maybe anticipated there from the Thanksgiving holiday? What's capacity right now?
So right now we're doing fairly well with capacity. We had prepared for an obvious recurring surge. After each holiday since the coronavirus has come out, including Memorial Day, the 4th of July, Labor Day, there was a surge. Unfortunately, the surge can still come later next week. The reasoning behind this is that sometimes it takes 5 to 7 days before people are symptomatic, and then they transmit it to other people, and it's sort of kind of a multiplicative effect. And that's why we're still worried that the next week or so may be problematic. And if that week goes further, it'll work right into the Christmas holiday, which will just be an additive effect leading into January in the next year. So we're still prepared for a surge, but right now we're taking care of our numbers and we're well prepared.
So, speaking of the remaining holidays that we have, for the year, given the recent extension of the epidemic order that we saw, that right now is till December 20th. If they see numbers, go down or plateau as a result of that initial epidemic order over the Thanksgiving holiday, is there, will we see something like that maybe extended through the remainder of the holidays into the new year?
It's possible. The concept that another holiday coming up may cause another surge is quite feasible, especially considering that many kids might be out of school, and anyway, for the holidays, they may just extend it through the holidays to prevent another surge. Hopes are with the vaccine coming out, if timing comes right, and we're able to vaccinate healthcare workers and everyone in the first lines, maybe we could reduce the time. We are looking to not only save lives, but also get back to the normal economy and normal lifestyles we've gotten accustomed to.
And again, we'll dive into the vaccines here in just a moment, but I have one more question to hit before that, and I do want to take a moment. If you are viewing here this stream, if you see that hashtag below my name, it says hashtag Hey Luke. If you have any questions that you would like to ask Dr. Assaad, use that hashtag with your question, and again, if relevant and appropriate, I'll be able to put it on screen and hopefully get that question answered. And we also did have some questions ahead of time that we'll get to again later in the conversation. But now I want to talk about the flu and COVID-19. We are in flu season. I want to talk about we'll start this question with the differences between the two, the flu and COVID-19.
Okay. So the flu, pretty much everybody is probably familiar with the flu a little bit. One of the most important things about the flu is that we've already had a vaccine. So we've been able to inoculate people and that way kind of keep the numbers for the flu down. Unfortunately, the flu is still a problem. We still have close to 1 billion people worldwide who get the flu. The difference between the flu, the two biggest differences with the flu and the COVID are that the flu tends to give you symptoms fairly quickly. You're exposed and within a day or so, you become symptomatic and then you're ill. The other issue with that is there's also treatment for the flu. There's been Tamiflu and other medications out for the flu for quite many years. As far as the coronavirus, two things are problematic with it. One, we don't have a treatment that's directly specific for it. We have some treatments when you're hospitalized that we're using that have been approved, but they're not as adequate as the Tamiflu has been for the years. The other thing is that you can be really asymptomatic for quite a long period of time with the coronavirus. And unfortunately, you may be spreading the virus, but unbeknownst to yourself or anyone else. And then added on top of that, we have long-term side effects from the coronavirus that we really haven't seen from the flu. There's been blood clotting issues, and those blood clots have affected people's brains, heart, and lung. So, and the inflammatory response is fairly brisk from the coronavirus. Now, to make things even more complicated, I know you didn't ask how they're alike, but the worst part is they're alike in symptomatology. So to separate them, it's virtually impossible just on a questioning clinical aspect. You'd have to be tested. As a matter of fact, they're so similar that a lot of suppliers have been sending out testers that test for the flu and the coronavirus at the same time, since they're almost impossible to separate clinically.
And so, are numbers down than what we normally would see at this time of year for the flu because people are, following the social distancing guidelines? Do the masks help in that sense with the spread of it, things along those lines?
Absolutely. So the numbers are definitely down. I've spoken to some infectious disease experts, and I looked at the CDC site, and the numbers are definitely down in our area. South of us in southern countries, they're up a little bit, but compared to the seasonal average, they're definitely down. And again, I would not take it for granted. I would not avoid a flu vaccine, and I would not avoid masking and distancing, because the peak for the flu season in our area is usually about February and March anyway. But we are still low for the numbers for this time of year. Usually by now we have so many positive tests that we routinely test for the flu on people who come in.
Interesting. Okay, so now let's dive in a little bit with the vaccine here. This is a day of all days with the FDA actually hosting that virtual conversation with Pfizer, the meeting on whether to get that approved or not. And, speaking of Pfizer, that's here on our side of the state out in Portage. Where does North Ottawa Community Health System stand with the vaccine in terms of getting it and getting the frontline workers, yourself, nurses, other doctors, vaccinated?
So as far as what we're doing, we put in paperwork to be allocated 1,000 shots so that we could do our frontline workers. And North Ottawa owns its own EMTs, and we have a few clinics. So as far as the first line, we're supposed to inoculate the active workers, nurses, doctors, mid-levels, everyone involved in frontline work with the coronavirus. So we are in the process of having that delivered to us. But as you mentioned already, the EUA is today. So as far as numbers and specific details, we don't have a specific timeline. We're hoping in the next week or so to receive vaccine and start the initial process.
And then, if you could hit on its distribution, we know that frontline workers will be getting it first, but if you could run through kind of the order of where that will go. Schools, I guess, would be another big one to kind of discuss how children will need them or not need them, but kind of just the order of how that will go.
So as far as children, the first problem is that a lot of the vaccines have not been studied in children or pregnant women. So actually right now, there's not a lot of evidence below the age of 16. So that'll be the first issue that needs to be addressed, partly because of the rapid assessment. There just haven't been many children in the studies. They've had a lot of people in studies. For instance, Pfizer had 44,000. Mrna had somewhere between 30 and 60,000. So it isn't the issue of volume. It's an issue of where they started the front line. So the way it looks right now is, again, there's going to be frontline workers will be the first line. And that'll include, like, again, hospital, urgent cares, and then long-term care facilities. So the reason that's going in the first line is, if you've read the articles, they are a very vulnerable population. And unfortunately, nursing homes have taken a big brunt of this pandemic. So they want to get them vaccinated, not only the residents, but the workers as well. Then there's a second tier that does include teachers, emergency staff, including police officers, the fire department. Then, and in between there'd be community workers. And then the third line would be people who are high risk, and people over 65 with multiple comorbidities. Comorbidities include diabetes, heart disease, hypertension, all the things that you probably read the press about people being hospitalized with the coronavirus. And then after that, sometime after that would be the general population, again, starting with people over 65, because again, just age obviously has been a predisposing factor. And so that's how it's been broken down.
And we did just get one question in here. This one is from Christine. Christine says, why does the vaccine need to be, why does it need to be stored at the temperature it needs to be stored at?
Right. So the reason, first of all, the first vaccine, Pfizer, is the one that has to be stored at sub-zero temperatures, 60 to 80. And that's just a product of its breakdown. If you don't store it at that temperature, it breaks down and loses its efficacy. The irony is Moderna has the same type of vaccine. So not to get too scientific or complicated, in the old days when you had a vaccine, you took the virus, you made kind of an inactivated version of that same virus, and that's what a vaccine was. So it would just give you enough to be immune to it without making you sick. This is the first mRNA vaccine that's ever been approved for use or even used. So just to be brief, an mRNA is a messenger RNA. I won't go through what RNA is because it's too scientific. But what it actually does is we inject something that tells your body to make proteins that recreate something like the spike protein on the top of the coronavirus. If you've ever seen all the pictures of the coronavirus, you see all the little spikes on it. And that is one of the most immunogenic, which means your body creates the biggest immune response to that, which is great because it really attacks the virus. So the problem is because of the mRNA, they all have to be refrigerated. But the Moderna, believe it or not, is just normal minus 20 regular freezer temperature. So it's just the Pfizer that has to be in because it's structurally more prone to break down at a lower temperature, which makes sense because a lot of times when we decontaminate things in the operating room, et cetera, we put them in really high temperatures and autoclave them. So that's how we actually kill most bacteria and viruses. So you can contemplate that anything that we create would be better, would be safer, more suited for lower temperatures to keep it stable.
Gotcha. Christine, thank you for asking that question. Dr. Assaad, thank you for answering that. That was a live question here on our stream. I do want to dive in now to some of the questions that we had ahead of time. We put this out about 24 hours ahead and got some overnight. This one is from Karen. She says, good morning. I'm curious if people who have already had COVID need to get the vaccine, and how will doctors be making sure whether or not a person has had it? I will start. This is a loaded question. We'll start with that.
Okay, so the issue is at first, that was a great question, first of all, because we didn't even know the answer to that question at first. But the final answer and the conclusion by the ACIP, which is, by the way, the just to give you the Advisory Committee on Immunization Practices. So they're the specialists within the CDC who decide who should get the vaccine, why, et cetera, decided that if you did have the disease, you should still be vaccinated. The reason behind that is they're worried that your own natural immunity is not lasting that long. And we have anecdotal studies. For instance, people have been donating convalescent plasma. And what's happened is when you give the convalescent plasma, they obviously check you for antibodies. And people have gone in and donated, and within less than 3 months, their plasma no longer had antibodies. So the concern is, depending on whether you're symptomatic or asymptomatic, your immune response may not be adequate, and you may be prone to catch the virus again. So the answer became, yes, we're going to give it to everyone, whether you've had the disease or not. And the issue is we're not testing you. They recommended not testing because, again, if you have positive antibodies, doesn't mean you're well immune. So the answer is you should be vaccinated regardless.
Gotcha. Well, Karen, thank you for asking that one. Dr. Assaad, thanks for answering it. You answered pretty much the last half of that question as well. So we'll move on to the next one. This one comes from Ruth. She says, her question is, I've heard that research shows someone who recovers from COVID-19 does not become reinfected or isn't able to infect others for 3 to 6 months. So I'll ask you, is that accurate?
Well, there is some accuracy to it, but that, again, is not 100%. So again, every single patient has a different immune system. So there's no guarantee that you'll be 3 to 6 months. Again, like my previous comment about people who are donating convalescent plasma, people who had gone in under 3 months were found not to have antibody at that point. So those people could possibly be reinfected. To make things even harder, to make things worse, there is anecdotal studies about people being reinfected. To make it harder, there are people being reinfected and they're getting a less severe strain of the disease. So what's happening is they're becoming asymptomatic. So one of the problems is we do not know that they're reinfected. They're not getting the whole blown spectrum like they were the first time, partly because they might be a mildly, because they might have antibodies that prevent them from getting severely ill. It goes along with the whole concept of the vaccine. So the issue is we do not know if you're carrying it again and whether you're contagious. So the answer to that is you can get it again. It's not as common as it should be the first time around, but there is a concern that you could be carrying the virus again.
And along those same lines, another part of this question, this is on mask wearing. Why are the many Americans who have recovered from the virus still wearing masks? And why aren't they allowed to visit their elderly parents, grandparents, go out to eat, send children to school, things along those lines? So mask wearing, another, big question.
Right. Again, for the same reason, because there is a small risk that you can get reinfected. Number two, the other issue is with the coronavirus going around, there are susceptible people who have the coronavirus where other upper respiratory infections, including the flu and other upper respiratory infections, which would normally be fairly benign, like the common cold, might make those people sicker. And again, unfortunately, the high-risk group is still the high-risk group. So the people who we worry the most about for the influenza are the same people who are dying of coronavirus. So it's the elderly population, the frail population, the immunocompromised population. And then the other thing to make things even harder is with the vaccine coming out, until everyone's vaccinated, there's still going to be a vulnerable population out there.
And we have another one here that this one comes from Andrew. We talked about the order of individuals who will receive this vaccine, the essential workers. He asked, will food service workers be able to get the vaccine? Do they fall in that category?
So food service workers, that's kind of almost a loaded question. Here's why. So food service workers who are necessary for a hospital or to keep hospitals running would probably be in the first category. But all food service workers will be considered in the second category already. Gotcha. So they already are specifically listed. There's actually specific lists by the ACIP on how it's all broken down. They're meeting again, though, later after the emergency use authorization. And again, they're going to make the final conclusions and recommendations. But right now, food service workers are in second line already.
Gotcha. Excellent. All right. Thank you. Thank you, Dr. Assaad. And thank you, Andrew, for asking that question. I do want to point out just real quick here, Dr. Assaad, the Zoom gave me a notification that our meeting will be ending, and that is because I don't have Pro Zoom. Apparently it needs me to upgrade, so we have about 2 minutes left here. So I want to ask you one more quick question, or if we can get in maybe two more. This one comes from Cassie. This says about herd immunity. Can you explain in a minute or so herd immunity, its effectiveness, how it works?
Okay, so herd immunity, now statistically, nobody ever wants to give a number of how many people need to be vaccinated or sick to get herd immunity. So what herd immunity basically means, if you vaccinate enough of the population, the virus or the illness will have nowhere to go. So you essentially killed it off by not allowing any more hosts to be sick. So if everyone's vaccinated and everyone's immune to the disease can't be passed around. So if enough people get it, it sort of almost kills itself off. So that's what the concept of herd immunity is. The problem is the higher the percentage of people that get vaccinated, the better the herd immunity effect is. So it's really important for as many people to be vaccinated as possible. Otherwise, the herd immunity effect just won't take effect. And with this new disease, we can't tell you what the herd immunity level is.
Gotcha. Well, it looks like we have about 1:15 here. We have one more. Thank you for that question. This one comes from Erica. Will you need to get the vaccination yearly, like influenza?
Again, no one knows that yet. So the one thing about getting this vaccine so quickly, we haven't had long-term studies. They know up to the 3 months, and every time they check it, people's antibodies are still positive and they're still immune. But again, you probably realize that the vaccine hasn't been out a year. So we haven't had studies. But the good news is the FDA and the CDC are pushing continuing studies even after the vaccine comes out. So we find out all those answers and details.
Gotcha. All right. Well, it's telling me that I have less than a minute here. So if I lose you while I'm wrapping up here, I apologize. Sure. And if so, I'll give you a call on the phone afterwards. But ladies and gentlemen, I am going to wrap this stream up simply because Zoom is telling me that it's going to bounce me here in less than a minute. So Dr. Assaad, thank you for taking the time and answering those questions. To those of you viewing, I hope that was helpful. This is exactly what we're going for, that you can get those answers or those questions answered in real time. Again, Dr. Haney Assaad of North Ottawa Community Health System. Thanks again, folks. Thank you for watching.